from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Now that's a beautiful lake, by the way, off of Mount Magazine. That's Blue Mountain Lake right there below. So Dr. Laura Wilson is here from Sherwood Family Medical Center to talk a little bit about swimming, not in the swimming pool. We know all about that, but swimming in lakes, rivers, some of these swimming holes, that a lot of people don't know about or go to. But a lot of kids like to do that.
That's right. I think it's funny, Chris, talking about swimming in rivers and all that. I don't remember being really worried about when I was little either, but there are some things that we should learn about. Okay. And I think the reason that this topic was chosen is because people worry a lot about the amoeba, right? I remember a few years ago that little girl that survived at Children's, which was close to a miracle. Yeah. But thankfully, that infection, which is called amoebic meningoencephalitis, or the brain-eating amoeba, is pretty rare. We've only had 130 documented cases in the United States since the 60s. So people worry about things like that, but the odds are very, very low. Yeah. Now, there are other infections that you could possibly get, but that would be more GI related. So there's a parasite called Giardia that you could get from streams that are contaminated, or even more commonly than that, perhaps, is the E. coli infection that you could get from a local swimming hole where they have sewage runoff, or other kids that have had recent diarrhea illnesses that they can share in the water.
Okay, so this is something that affects your tummy more than what
typically more of a recurrent diarrhea kind of thing. Okay. Most of those would be self-limiting. Now, of course, a couple of them, the serious E. coli's or Giardia would persist and ultimately need treatment, but a lot of those would just kind of be a mild diarrhea and go away on their own. Okay. Again, even those aren't that common, but that is one thing to be aware of, more so than the amoeba. Yeah, right?
Yeah, exactly, than that rare case. Because we do get, news stories occasionally that some of the beaches have been closed because some of it's been detected.
Right, that's right. Mm-hmm. So more significant things to worry about in swimming holes actually aren't the infections. Of course, remember those. But the other things to think about are unexpected depths or currents. With your local swimming holes, if there's been a lot of rain, all of a sudden they could get way deeper than you expect, or unexpected currents, even if you've swam in that little hole before. Water hazards such as rocks and branches that may have been not visible, because the water's risen so high. Things like snakes, right? Yes. If I saw one, I'd hop right out.
And that's probably a good idea to hop right out, right? Just get away from it.
Right. The other concern is just the fact that these swimming holes are not supervised, and oftentimes you'll be only one or two people swimming in them. And so if something does happen, there's not a mass of people to help, and certainly not a lifeguard. Right. And then sunburn. I had to throw that one in, right?
Sure. I mean, that's going to become more and more of something we got to think about.
Right. I think a sunburn is more of a common risk than the amoeba, right?
Yeah. Like what you'll see more of probably in your office.
That's right.
Okay, tips then for freshwater swims, and some of this kind of goes along with, just be sure there's somebody there watching.
Right. So have a group with you, at least, 2, 3, 4 people would be ideal, so that you have other people watching. You don't want to swim near waterfalls, so this is kind of interesting when you really think about it. Of course, you don't want to swim at the top of a waterfall because you could fall over, but lots of people like to play underneath, and there's the risk of hazards like rocks or branches falling over on you. Yeah. And there's actually been deaths reported from that, so that's another thing to be cautious of. Again, as we mentioned, the sewage runoff and E. coli, you want to look and make sure there's not any evidence of, obvious sewer drainage. I remember there was a creek when I was little, you could see the sewer running into it.
Oh, no.
Or something like that. Yeah. Or if there's farmland around, if they've had a lot of rain, pesticides and things could wash into the water. So that'd be harder to see, but you just have to kind of know the area to know if that was a risk. No diving, of course, because we don't know depths or hazards. Right. Water shoes are a good idea because of rocks and glass and things broken down on the ground.
I love Lake Ouachita and feel like I know it well, but it always changes.
That's
You're right. The depth can change, and so many things just look and feel different from one weekend to the next. Okay, going back though to the GI thing. Right. I mean, what does it feel like when it's first coming on? What do we look for?
Well, usually it'd be a couple days at least incubation period from the time you get exposed to the time you have symptoms. Okay. And usually, like specifically with Giardia, you'll have a real crampy, intermittent abdominal pain with diarrhea. You could have vomiting, but usually it's kind of more the lower end. The E. coli, the really severe E. coli, you'll present with bloody diarrhea, which of course gets everybody's attention. The Giardia, the first day or two, you might just call it a virus and not be too worried about it, but it will tend to persist. And so because of the persistence, that's what's probably going to get you into the doctor's office to seek treatment.
I think you told us before, tell your kids to keep their mouth closed when they're swimming.
Yes, I did mention that one. That's a huge one, yes. Don't drink the water because, of course, drinking it increases your risk for picking up these infections.
Exactly. Keep your mouth closed. Okay. All right. Well, great information from Dr. Laura, of course, at Sherwood Family Medical Center. And you can go find them, of course, if you need any help with your health as well. as well. And also some websites you can go to, which will keep you up to date on any beaches that have been closed too. Thank you, Dr. Laura.
Let me mention that last one is kind of an unofficial website. I found it when I was kind of reading about the topic.
Yeah.
And it kind of lists the swimming holes around the area and their depths and things like that. But I wouldn't promise by that one. I just thought it was interesting. The top one is where you're going to find the arkansas.gov, is where you're going to find the actual closings of, Arkansas beaches and things because of contamination.
And then for fun, maybe swimmingholes.org.
That's right.
Thank you, Dr. Laura.